What do cytogenetics, results from a leukemia bone, marrow biopsy mean? Imagine looking at the tiny building blocks of cells to understand what makes leukemia different from other blood disorders. When doctors perform a bone marrow biopsy to diagnose leukemia, they often analyze the chromosomes of the leukemia cells through a process called cytogenetics. These results are like a detailed map that shows the structure and number of chromosomes in the cancer cells. This information helps doctors figure out exactly what type of leukemia a person has, how aggressive it might be, and the best way to treat it. The process begins with collecting a sample of bone marrow, usually from the hip bone, and then growing those cells in the lab. The cells are encouraged to divide so their chromosomes can be seen clearly under a microscope. This is called karyotyping. Usually at least 10 to 20 cells are examined to ensure the results are accurate. Sometimes, if the cells don't grow well or if quicker results are needed, a special test called fluorescence in situ hybridization, or FISH, is used. FISH uses fluorescent probes that attach to specific parts of the chromosomes, allowing rapid detection of certain abnormalities within just a few days. So what do the results tell us? If the chromosomes look normal, with no visible changes, it's called normal cytogenetics. This can sometimes mean a better outlook, but it doesn't mean there are no genetic mutations at the molecular level. If abnormalities are found, they can be very informative. For example, certain translocations, which are pieces of chromosomes swapping places, are linked to specific leukemia subtypes. The famous Philadelphia chromosome, a translocation between chromosomes 9 and 22, is a hallmark of chronic myelogenous leukemia and some cases of acute lymphoblastic leukemia. Other changes like deletions or extra copies of chromosomes can also be detected. For instance, loss of chromosome 7 or 5 often indicates a poorer prognosis, meaning the disease might be more aggressive. When multiple abnormalities are present, it's called a complex karyotype, which usually suggests a more serious disease course. These chromosomal findings are not just labels, they guide treatment decisions. Knowing the specific abnormalities helps doctors decide whether targeted therapies might be effective or if a stem cell transplant might be needed. They also help predict how the disease might behave and whether it might come back after treatment. Sometimes, cytogenetic testing is repeated during or after treatment to see if the leukemia is responding or if it has relapsed. It's important to remember that cytogenetics has limitations. Sometimes, the cells don't grow well enough in the lab, making it hard to get clear results. In such cases, molecular genetic tests like PCR or next-generation sequencing can detect mutations that aren't visible through traditional cytogenetics. These tests complement each other to give a full picture of the leukemia's genetic makeup. In summary, cytogenetics results from a leukemia bone marrow biopsy reveal crucial information about the chromosomes in leukemia cells. These findings help doctors accurately diagnose the type of leukemia, understand its likely behavior, and choose the most effective treatment plan. If you or someone you know is facing leukemia, it's essential to work closely with healthcare professionals who can interpret these results in the context of the individual's overall health and specific disease features. Always seek personalized medical advice, and remember that ongoing research continues to improve our understanding and management of leukemia.